Okay, this is video 2. Actually, this is going to be about what happened between the time that I came home up until the time that I had the orthopedic surgeon appointment. So, first of all, the lower portion of my leg swelled substantially, and the foot. Quite literally, my calf all the way down to my foot was nearly the size of the middle portion of my thigh. It was amazing. I'd never seen anything like it. It turned extremely black and blue up along the back portion of the calf. My foot turned completely black and blue as well. We iced it a bunch. Now, we went out and got one of those ice machines that we used. It just didn't seem to work really well. I couldn't get enough cold, so we just went the old-fashioned way, which was literally, Ziploc bags and ice, and just kept putting them on there and putting them on there, and that tended to work. But it didn't really reduce down, frankly, the swelling that much, from what I could tell. It started to get kind of itchy and sweaty, and they put you, in kind of a brace ace bandage type of a situation. Along with with me, they put like a fiberglass piece to hold everything together. So that did get a little itchy, and I did end up taking that off to try to get some air to the foot, as well as get the ice on it so that it could actually start to reduce the swelling down. One of the things that happened to me is I had what were referred to as fracture blisters. And I'll try to put some pictures up on that as well in the video here. Because of the way that I fell and the amount of pressure, literally my surgeon told me that my foot exploded. And my lower leg exploded. The skin actually separated. And when it separated, it creates those big blisters. Those blisters went all the way from basically kind of curving around at the bottom of my foot on the inside, all the way up my calf leg. And they were huge, filled with fluid. We did not pop them, which was something that the surgeon said was something that was good that I didn't do that, because it increases the risk of infection. Some of those had blood in them. They were definitely not enjoyable to see. Again, don't drain them, from what my surgeon told me. I did stay in bed, in the center of the bed, had my head up, and then a little bit, and then the leg up, and used the pillow as I showed in the last video, this one here, which we were able to get through a medical supply house or at CVS, one of the pharmacies, etc. Again, falling off the bed was something that I didn't really experience, because I was so used to just kind of getting up. So you might want to put maybe some pillows below the bed, and then maybe on the side of the bed, so that you don't fall off of it, or at least you're kind of woken up that, guess what, I do have this situation, so that you don't end up just stepping off. So that was really between that. At that point in time, that's when I actually did work the next day. It was, I would say that it wasn't the most comfortable thing, certainly, but I just sat up in bed, kept the foot up, had my computer, and was able to do some work there. I don't think I would recommend that, frankly, after having done it. I think I would have it would have been better just to have taken a few days off, just to kind of let my body reset. The other thing was I drank a lot of water to really try to keep myself hydrated, and that tended to I think be a benefit. And the other thing is, don't fall behind on the pain meds. I did do that. I skipped one in the middle of the night. I just didn't happen to wake up to take the pain meds, and I paid the price of that later in the day. So, if they say to take it every 4 hours, get up every 4 hours and take those pain meds, because that you're definitely going to want to stay on top of it, because it took me basically another 2 cycles of pain meds to get caught up on the pain. and that's certainly something that you don't want to deal with. Okay, next video will be on the orthopedic surgeon visit.